Hi, my name is Dr. Aaron Burnett, and I'm the Assistant Medical Director at Regions Hospital EMS. We have a brief video we've put together to go over the contents and deployment of a recently developed RegionsEMS trauma pack. This will be deployed on all squad cars in the city of St. Paul. The RegionsEMS trauma pack contains several important pieces of equipment which can be life-saving when used appropriately. The first thing to recognize is some personal protective equipment. As all of you are aware, blood and body fluids carry transmissible diseases including hepatitis and HIV, so ensuring provider protection is a key component of this kit. We also have tape and band-aids as well as some gauze to deal with minor injuries. For more severe injuries, which can be life-threatening, the kit contains both a tourniquet and an Israeli bandage. We'll be demonstrating the use of both these devices shortly. At RegionsEMS, we feel very strongly that rapid application of tourniquets in life-threatening hemorrhage is life-saving. We've seen this in St. Paul as well as at Regions Hospital. In order to be effective, tourniquets have to be applied quickly and in the right location. In the extremities, the anatomy implicates where we want to place a tourniquet. Below the elbow and below the knee, there are two different bones. And when arteries get severed, they can retract in between the bones. This is a challenge when placing a tourniquet because the bones will limit the amount of compression that tourniquet is able to actually apply on the artery. For these reasons, we always want to place the tourniquet above the elbow and above the knee, on the thigh or the bicep. The other thing to keep in mind is when arteries are cut in half by a bullet or a knife, the muscular structures of the artery retract that vessel proximally up towards the center of the body. This can occur for several inches. When placing a tourniquet, you want to place it at least 4 to 6 inches above the site of injury. However, we always want that to be above the knee or above the elbow, so over the bicep or over the thigh. In that area, there's only one bone, the humerus in the arm and the femur in the leg. So as long as that tourniquet has the appropriate amount of pressure, there's no way for that artery to hide from that pressure and avoid being compressed. We'll now demonstrate application of the CAT tourniquet. When you encounter life-threatening hemorrhage, the first thing to do is apply direct pressure. If there is no assistant available, you may go directly to applying the tourniquet. Remember, the tourniquet should be at least 4 to 6 inches above the site of injury and always above the knee or the elbow. As you cinch the device down, you'll begin to apply pressure. However, this will often not be enough to stop the bleeding. There's a twist tie on the top of the tourniquet which should be cinched down tightly. This will be uncomfortable for an awake patient. However, do not allow discomfort to stop you from cinching down the device. You will know when you've applied enough pressure because the bleeding will have stopped. If you find you are unable to control the hemorrhage, continue tightening the device. An additional option would be to move the tourniquet higher up on the leg or the arm, closer to the torso, so that if the vessel is retracted farther than you initially thought, you will now catch that. As the environments in which you work are often dark, cold, and with poor lighting conditions, you should practice placing this tourniquet on yourself or your partner in the dark and be ready to apply it in under 30 seconds. The second key hemorrhage control device in the RegionsEMS trauma pack is affectionately known as an Israeli bandage. Like the CAT tourniquet, this device has been time-tested on the battlefield and has been shown to save numerous lives. This device should be thought of as a pressure bandage, not a true tourniquet. You open this device by tearing along the side and removing the device from the packaging. It's shrink-wrapped and very compact, which is one of the benefits. It then has a plastic coating which also needs to be removed. The device is a long, stretchy, elastic bandage with a large absorbable pad that should be applied directly to the wound. The device also has a method to cinch it down similar to the CAT tourniquet, but due to the elastic nature of this device, it should only be thought of as a pressure bandage, not a true tourniquet. Once you've decided to apply an Israeli bandage, take the non-adherent absorbable pad and place it against the wound. Wrap the bandage circumferentially around the extremity. The plastic bar on the bandage is designed to allow you to apply additional pressure. Loop the bandage underneath that bar and then reverse direction This will allow you to cinch the bandage down more completely. Continue wrapping the bandage around the extremity to apply additional pressure as well as to absorb any blood which may continue to bleed. Remember, this is a pressure bandage, not a tourniquet. Once the bandage has been completely applied, you'll notice that there is a plastic bar which allows you to both gain additional pressure and also secure the device in place. Lift your bandage, 2 to 3 layers will be sufficient, and place the bar through the device. Do this directly on top of the wound. You are then able to twist the bar and apply additional pressure. It's important to do this on the top of the wound because that is the location that you need to be applying pressure. The bars on the side of the device then have teeth which will allow you to place the bandage through those teeth and secure the device in place. Now that you have your Israeli bandage applied, it's important to reassess the extremity and see if your bleeding has stopped. If the bleeding has not stopped, it would be appropriate to consider applying a cat tourniquet farther above the wound. Once an Israeli bandage or a cat tourniquet are applied in the field, they should not be removed until the patient arrives at the hospital and blood products can be administered should the bleeding continue. These RegionsEMS trauma kits will be deployed in every squad car in St. Paul. They're primarily designed to help keep you and your partner safe. Rapid application of the cat tourniquet or an Israeli bandage can be life-saving. Practice deploying the cat tourniquet on yourself or your partner. You should be able to put this device on within 30 seconds in the pitch black. Our mission at RegionsEMS is to help keep you safe as you protect the citizens of St. Paul.